Nurse Awesome. So we're going to chat a little bit today about communication with patients and their families. I have to be honest with you, this is an area that really surprised me when I got out into the world of nursing because I had a lot of corporate experience. I thought that communication with other human beings was something I had down pretty well. Lord knows I've taken tons of classes about how to communicate and emotional intelligence and whatnot. I gotta tell you though, it was really challenging for me at first, learning how to communicate with patients. So this video is just a quick kind of how I am doing it, what I've learned over the last year, and what might help you. Please keep in mind it's only what's been working for me. First thing, you guys don't take anything your patient says personally because you know that being in a hospital makes people stressed. Being sick, being in pain, it changes your perception of reality. It changes the way you interpret information, and it changes the way you communicate with other people, right? You know that because of your own experience. So try to keep that in mind when you're talking with your patients. The golden rule really goes a long way here. Even when your patient is being a fusspot, if you'll try to treat them the way you want to be treated, it can help you have a much better shift and your patient have a much better experience during that shift. The other thing I would say is I really learned that I had to have an open mind whenever I walked into a patient's room and kind of lay aside my own opinions and my own judgment and my ego. I just had to be really open whenever I walk in and introduce myself because I never know what I'm going to get. So I had to be kind of in that open space instead of having a preconceived notion based off of either the illness that someone had, the state that they were at in their illness, or what another nurse said to me, in shift report. So you guys just have an open mind when you start your shift, okay? The other thing that's really been helpful to me, even though it sounds super easy to do, is just to kind of stop and give your patient your full attention and actually listen. I think that people can really feel when you're listening to them and when you're kind of just half listening. When you're flat out ignoring is certainly clear. So if you're super busy kind of typing on the computer or buzzing around the room doing some other things, when you ask them questions, they might not get the vibe from you that you really care. If you take a second and just stand next to their bed and look at them in the eye, that goes a long way, It really makes them think you're listening whether you are or not, The other thing I figured out that works really well for me is that at the very beginning of the shift, I'm going to tell them what the plan is for us that shift, It just sort of gives them a sense of knowing what's coming up for them, knowing what to expect from me. If I tell them, for example, I'm going to be in every hour to check on you, I may not wake you up, but I'm going to be looking at your vital signs and making sure that you don't have any needs that aren't being met, making sure you're not in pain, making sure, whatever it may be that you're looking for. Or if your patient's in a lot of pain, if I say to them, here are the things we're going to do to try to manage your pain. And really, in an upfront way, I usually tell them that we're probably not going to take care of your pain completely, especially if they're post-op day one from some very difficult surgeries, or if they've been on pain medication for a long time before they come into the hospital. I don't want them to think that our goal is to make them pain-free, because it probably won't happen and have them still breathing, right? I want them to know, I want them to have the expectation that we're going to work really hard together to make them comfortable so that they can sleep, but that pain-free is probably not the best term to use, right? The other thing is that I always try to make sure that I keep whatever promise I make. So if I maybe at the beginning of the shift will introduce myself and tell them what's kind of the rough plan is for the day, ask them if they have any needs, tell them that I'm going to go next door and check on their neighbor, and then I'll be back with them in an hour. Then that's exactly what I do. I'm not going to go and get involved in something else before I go check back in with that patient, even if it's just to say, hey, something's come up that's required my attention. Are you okay? I just wanted to check back in with you because I told you that I would. That kind of action from you goes a long way to build trust with your patient and establish some integrity from you. And that's really kind of conveys the message to your patient, you're safe. The other thing I've learned, I guess, is don't be afraid to apologize if it's needed. If you happen to not be able to keep your word for some reason, they don't need to know all the details. They just need to know that, hey, I'm sorry that I didn't do what I said I was going to do. So also I've learned that I don't need to be afraid to be firm with my patients and let them know that they are in the hospital and there are some things that they will not be able to do while they're there. That kind of lets them know up front that there will be, some boundaries that are for their protection as well as mine. Especially in an ICU environment, that's kind of important. Having tons of family members in the room, people that want to sleep in the room, want to bring food from home, that sort of thing. This is, a controlled environment for a reason. You're in ICU because you are unstable, and it's my job to keep you on the stable side of things. Anyway, just, being honest with them about that kind of stuff helps a lot too. As a brand new nurse, I think probably one of the most important things you can do is to look for some really great role models. You can kind of feel really quickly the other nurses on your unit that are like you, that have the same kind of core belief system, that do things that you can say to yourself, yeah, that's the kind of nurse I want to be when I grow up, right? So look for those people and then really kind of emulate them. Don't be afraid to ask for their advice if you find a particularly difficult situation. Don't be afraid to ask them to help you because most of them will be happy to do that. I was really fortunate that I had the most ass-kicking preceptor the last part of my mentor program that I went through as I started in ICU. He was really, really smart, and he was very efficient. He was the kind of nurse that I want to be when I grow up. He could jump into the middle of any intense and life-threatening situation and make things better. He was really smart about all of the pathophysiology, medications, procedures, and whatnot. And he was also very kind to the patients. He never let the fact that he was in a critical care environment supersede the fact that he's dealing with a human being who is probably scared beyond belief that they are in intensive care, right? So I was really, really fortunate to have somebody like that teach me at the very beginning of my career. You guys look for that. Look for someone that you want to be like and then pattern what you do after them. It will help you a lot to kind of start to form your own, awesome plan for nursing, right? I guess the biggest thing that I want to convey to you guys is that what patients are really looking for is for you to convey to them in everything you do that they're safe and that they're protected and that you have their best interest at heart. They want to know that you're not going to let anything bad happen to them if at all possible during that shift. And so every action that you take or don't take, every word that you say or don't say, should be with that in mind. This is another human being, right? Your ability to be transparent with them will transform the way that they think about you and maybe the way that they feel about their experience or their illness, Anyway, that's probably all I have to say about it. There's a lot of specific stuff that you can get into about communicating with patients when they're fussy, families, whenever they're fussy. Didn't want to get into that here. I just kind of wanted you to hit the highlights of what I learned over the last year as a brand new nurse. Hospitals equal stress, have an open mind, listen to your patients, make a plan, do what you say you're going to do. Don't forget the golden rule. It's pretty simple stuff, you guys. So I know that you're doing an awesome job in school, and I cannot wait to hear how you use some of these tips as you talk to your patients. Until next time, you guys keep on being awesome. Peace.